All right, let's get right into it. We're going to tackle a really important topic today. How do you actually recognize when using a substance crosses that invisible line from just being a habit into being a clinical problem? We're going to break down the exact framework professionals use, not for diagnosing yourself, but for really understanding what's going on. This is the big question, isn't it? Whether we're asking it about ourselves or someone we care about. Is this just for fun? Is it a way to cope? Or has it turned into something more? To get a real answer, we need a clear, structured way to look at it. So here's our game plan. First, we'll define what a disorder even means in clinical terms. Then we're going to walk through the 11 key signs that are used for assessment. After that, we'll see how severity is measured, explore the real-world consequences, and then wrap up with a tool you can use for some personal reflection. Ready? Let's dive in. Okay, first things first. Before we can get into the details, we've got to make sure we're all speaking the same language. Let's get clear on a few key definitions, because they're the foundation for everything else we're going to talk about. The first term is intoxication. This is the one we're probably all familiar with, right? It's just the technical term for being drunk or stoned or under the influence. It's all about the immediate effects the substance has on your body and your brain. The slurred speech, the mood swings, not being able to focus. It's the direct result of that substance at work. And then you've got the flip side, withdrawal. This is what can happen when the substance starts to leave the system. If your body has become physically dependent on something and you suddenly stop or cut way back, it protests. And those reactions, which can be anything from kind of uncomfortable to really severe, are what we call withdrawal symptoms. And that brings us to the big one, substance use disorder, or SUD for short. Now, what's really, really important here is that the clinical definition isn't about how much you use or how often. The absolute key is whether that pattern of use is leading to significant impairment or personal distress. It's all about the negative impact it's having on your life. So, how do clinicians actually measure that impairment or distress? Well, that's where these 11 specific criteria come into play. They're broken down into a few groups that help paint a really clear picture. Let's get into that first group. This first cluster of signs is all about what's called impaired control. It's basically that feeling that you're not really in the driver's seat anymore. The first sign is using more of something or for a longer time than you meant to. And the second is that nagging feeling that you want to cut down, you even try to, but you just can't seem to make it stick. And this example with Lisa, it just hits the nail on the head. She has a plan, right? Just a few drinks. But the reality is always different. That gap, that disconnect between what she intends to do and what actually happens, that's a classic sign of impaired control. The next group of signs revolves around life disruption. This is where the consequences really start to show up on the outside. We're talking about things like struggling to keep up with your responsibilities at work or at home. It's about continuing to use even when you know it's causing fights or problems with the people you care about. And it's that slow process of giving up the things you used to love, hobbies, sports, hanging out with certain friends, because using the substance just takes priority. Melissa's story is such a powerful example of this. The problem isn't just a private thing anymore. It's having huge real-world consequences, like losing jobs. And it's pushing out other important, healthy parts of her identity, like being a swimmer and a tennis player.
Okay, the last group of criteria gets into risky use and the more physical side of things. This is where we see craving, that really intense, almost overwhelming urge to use. It also includes repeatedly using in situations that are physically dangerous, like driving while impaired. And, of course, it includes the two classic signs of physical dependence: tolerance, which is needing more and more to get the same effect, and withdrawal, which we talked about earlier.
This example with Patricia is so important because it shows a really dangerous mental trap. She might not feel drunk, but that feeling doesn't change the scientific fact that her reaction time and judgment are impaired. This is a perfect and unfortunately common example of using aerosol in a physically hazardous situation. So, we've got these 11 signs, but here's the thing. It's not like it's a simple yes or no situation. A substance use disorder is understood to exist on a spectrum. Let's take a look at how that's actually measured. It's actually pretty straightforward. The severity level is based on how many of those 11 criteria a person meets. If you check 2 or 3 of those boxes, it's classified as a mild SUD. 4 or 5 symptoms, and you're looking at a moderate disorder. And if someone meets 6 or more of those criteria, it's considered severe. The spectrum is so important because it reminds us this isn't a one-size-fits-all problem. Okay, so we have the clinical framework down. Now let's connect it back to real life. Because a diagnosis is just a word, right? What really matters are the consequences, what we can think of as the ripple effect. And as you can see, the impact is almost never just in one little box. It's a ripple that can spread out and touch every single part of a person's life. Their physical health, their job, their family, their finances, their emotional well-being, you name it. It truly can affect everything. Let's look at a couple of these more closely. Let's just break that down a bit. On the health side, the risks can be terrifying. You have the immediate dangers like accidents and injuries, and then the long-term stuff like liver disease, heart problems, even cancer. And then in someone's work or school life, it can create this downward spiral. Performance slips, opportunities are lost, and it can sometimes completely derail a career path. And the impact on a person's private life can be just as heartbreaking. It causes so much stress and destroys trust within families, often leading to broken relationships or divorce. At the same time, financially, it can be a perfect storm. You're spending more money on the substance while also potentially losing income from work. It can lead to serious debt and instability. We have covered a ton of clinical information here, but the goal isn't just to memorize facts. It's to give you a framework for understanding. So I want to end with a tool that's not for diagnosis, but for reflection. This is called a self-rating scale, and it's designed for private, honest reflection. It asks you to rate yourself on 3 things. First, looking at all those potential consequences, how severe do you feel the problem is? Second, how strong is your own personal motivation to change things? And third, how confident do you feel in your ability to actually follow through? It's just a simple, non-judgmental way to kind of check in with yourself. And I really want to end on this point because it's the most important one. The whole purpose of this framework, all 11 of those criteria, is not to slap labels on people. It is to provide a clear, structured way to understand a really complex and difficult human experience. It's about replacing judgment with a little bit of clarity. So I'll leave you with this final thought. Whether it's for you or maybe for someone you're worried about, if you were to honestly use this framework just as a lens for reflection, what do you think it would reveal? Thanks for watching.